Hello there everyone, it's Rebecca again. I'm going to discuss the hip and the muscles that involve and the actions that they do. Now the hip is slightly different from the knee and ankle with what how the muscles act upon it, as you'll soon learn with the other videos. So let's get started. So we have the hip, this region here, you can see anterior, posterior, and the way that you flex your hip is you bring the limb to the body. Now you can have your knee extended as well whilst you do that, but the hip is still flexed. To extend the hip, you bring the limb away from the body. So you can see it opens up the hip there. Adduction is adding a limb towards the midline, so that's bringing the leg across the midline itself. And abduction is taking something away, and so that's abducting the hip, moving the limb away from the midline. External rotation is quite a crude way of remembering, but lying back and think of England, you externally rotate your hip outwards, so you're opening the thigh and the leg. So you go from neutral to external rotation, and the internal rotation is the opposite. That's when you bring it inwards and you're curving the leg towards the midline. Now we'll talk about the muscles that flex the hip. So, get my little sheet. You have what's called psoas major. That originates in your lumbar region, which is the lower section of your back, and it comes forward through the hip and over your, it's like a pubic region that connects from your pubis to your iliac crest. Sort of goes over there and inserts to the lesser trochanter of your femur. At the same time, it connects to what's called iliacus. And iliacus comes from your iliac crest, which is the rounded top part of your hip, of the hip bone here, and it goes from the inside of that and joins psoas major, goes over this pubic region and inserts into the lesser trochanter of your thigh, of your femur. So as we spoke before, to flex your hip is to bring the limb to the body. These muscles here, to flex, they what we call concentrically contract, which means go smaller. So if you think of this muscle here, it's sort of within the hip kind of thing, and for it to tighten up, it grips and pulls the limb towards. So I'll try and get close so you can see. So if you imagine the two here that are joining together as one, and if they go shorter, there you go, you flex in the hip. Along with those two, the psoas major and iliacus, or iliopsoas as it is commonly known, you have a muscle called pectineus. So apologies for the way this was. Pectineus is a muscle that attaches from your pubis, your pubic bone here, and attaches to the femur. It's the most, what we call the anterior muscle of the adductors. It has two actions. It flexes the hip and it adducts as well, because of where it is. Because it joins to the hip, it has an action upon that hip. And because it's sort of towards the front and goes to the femur here, when it tightens up, as well as with all the other muscles firing at the same time, when it shortens, it goes together like that, lengthens, it allows it back down. So that's sort of in this sort of region. Then we have rectus femoris. Now you're wondering, hang on a minute, that's an extensor of the knee. It is. But because rectus femoris goes from the knee to your hip, iliac crest here, this tuberosity here, it has an action on the hip. So if you imagine all this tightening up as one, including the upper half with the hip, it's like you're pulling it all together. Now if you try and work both sections of rectus femoris, so not only flexing the hip but extending the knee, I can't keep that for a long time because my rectus femoris isn't that strong and I start to wobble and it hurts. But that's when it's using all of its muscles together. Okay, so we'll go into that later on. So you just have to know that rectus femoris here in the anterior compartment of your thigh, when it contracts concentrically, it flexes the hip. And then along with that we have sartorius, which has an insert and origin at the knee, here, and at the hip. So because it's attached to the hip, it has an action on the hip, and so it can tighten up that way. So it goes from here, snakes across to the hip, and so when that concentrically contracts, whoop, flexes the hip. And then we have what's called the tensor fasciae lata. Amazing word. Basically, it's a muscle. It's a small muscle here on your thigh. I don't know if you can see that. Say that sort of section. It attaches to the iliac crest here, and it connects to a massive band called the iliotibial band. So called because it goes from the iliac crest of your hip, ilio, and goes to your tibia. So iliotibial band. And that's like a very thick tendon. It's connected to the fascia, so the tensor fasciae lata, which coats the thigh. And because this muscle's here on the hip, it does have two actions, but it's also part of the flexion of the knee because it comes to the anterior part of the hip. So it helps. Along with all the other muscles, it has that action. Although its main one, because it's lateral, is to abduct the hip. So that's flexion. They're the muscles. So the muscles on the anterior compartment here flex the hip. Okay? Remember here, flex the hip. Then we have extensors. So these are the back. So what we have first is gluteus maximus. Everyone knows that one. Your ass cheek, your ass muscle. This muscle, there are three in your bum. I'll come closer because they'll see my arse in widescreen. And it goes, you've got your hip here. Imagine the shallow band as being the hip. Gluteus maximus sort of goes from the crack area here and across this way. You've got two others that are below it, which is, my brain's gone now, medius, which is here, and goes down, and minimus, which is underneath, which is sort of like more towards the your bum cleft, and goes down. So, you've got gluteus maximus here, that goes round, and it attaches to your femur. So if you imagine this pulling from your thigh, from your femur, upwards, your leg, your hip extends. It's just like pulling that string and it goes. So to concentrically contract your gluteus maximus, it extends your hip. The next one is biceps femoris. It has two heads, and the long head, it's on your lateral side, comes from below the knee and up the femur to the hip, and it sort of, can't really feel it in my bum, but you have your ischial tuberosities, or your bony bits of your bum. So it goes from the knee to those. So if you imagine having a piece of string there and pulling that up, it extends the hip. So that's on the lateral side, extending it. Then we have, which the biceps femoris helps gluteus maximus because they're all on a similar size of where they insert. Then on, it's going to look even worse now. On the medial side we have semimembranosus and semitendinosus here. Again, they insert around the knee on the medial side and attach to around the tuberosity, if I remember correctly. Which I'll just quickly check because I don't need to have the wrong information. Yes, they do. The ischial tuberosity there. So, they go from the medial side, so just imagine a bit like biceps femoris in here. Just on the medial side, you pull that string. Oh, my feet are disgusting. I've been doing some tutorials today, so my feet are black. So if you pull those medial ones, you extend the hip. So it's just like biceps, just on the middle. Now, the one that you won't particularly remember or know that also helps with extending the hip is what's called adductor magnus. Now you're thinking adductor, it adducts the leg and the thigh. You're right. But because of where it's positioned on your femur, it is classed as the medial compartment, but it attaches sort of posterior of the femur. So it can be innervated by the sciatic nerve, which runs along the back of your thigh, to help with extending the hip. So that's the extensors. It's going a little bit on. Let's see what time I'm on. That's 11 minutes. Woo! Right.